Hello, everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. And for those who don't know me, my name is Dr. Arinola Dada. I've been a rheumatologist for the last 20 plus years in the greater Seattle area. Today, I have another rheumatologist on the show, Putz. And Dr. Putz is a rheumatologist that has been working in our clinic. And so he's here today, and we are so excited to have him. So, Dr. Putz, welcome to the show.
Hi, thank you very much. I'm very excited to be here.
And Dr. Putz, can you tell us a little bit about who you are and why you do what you do?
Yeah, so I was originally from Iowa, born and raised in the Midwest, and then made my way out here as an adult to the Seattle area. And I've spent most of my life here. I moved around for some of my training. I did residency back in Iowa and my rheumatology training at the University of California in San Diego. But I'm very excited and glad to be back up here in the Pacific Northwest and working with this terrific clinic here at Overlake Arthritis.
Yeah, I agree. It's terrific. So, today we are going to talk about rheumatoid arthritis. And so let's just get down to it. Rheumatoid arthritis is it's an autoimmune disease. And Dr. Putz, can you tell our patients a little bit more about rheumatoid arthritis and perhaps how does it differ from something like osteoarthritis?
Yeah, so like you mentioned, rheumatoid arthritis, it's a chronic autoimmune disease. And what happens is the immune system, instead of the normal surveillance and attacking the bad guys like it does, it mistakenly attacks the joints, and that causes inflammation, pain, stiffness. It can affect anyone, any age, any gender, and if left untreated, it can lead to really severe joint damage and disability and lead to a lot of chronic pain. I think RA is very complex, but it's a manageable condition, especially the earlier that it's diagnosed and treated. We have much more options in our armamentarium to treat it now than we ever have, and that's always evolving, which is fantastic. And I think it's very important to separate that from osteoarthritis, which is a much more common condition affecting the joints where it's not the immune system per se attacking the joints and destroying them, but more of a wear and tear from using your joints as you get older that some people are more prone to getting than others, but it can look a lot like rheumatoid arthritis to people who aren't familiar with it. And so that's our role in rheumatology, is to be able to explain and show those differences and get to the right diagnosis.
Yeah, that is so true. So, for instance, I had a patient that said, um, do I have rheumatoid arthritis or do I have osteoarthritis? And please don't tell me I have both. And she was 70 years old. How do you address that?
Yeah, so I think it's important to explain that you can have both, and many people do. Um, so getting a good history, finding out the symptoms, when it started, and then a physical exam. I think in terms of medicine, that's the greatest thing that we offer in rheumatology, is that we're experts in joints. And so a physical exam is paramount to that, being able to feel and touch the joints, combining that with laboratory studies and imaging studies to see what those joints look like, and being able to make sure we have the right diagnosis, and explaining that, yes, you can have both, especially in the older population, because like I said, our joints, they're mechanical joints. They sort of wear out over time, and some people develop osteoarthritis regardless of if they have any other disease. And so just like you can have high cholesterol and hypertension and diabetes and all of these other diseases, you can have multiple autoimmune diseases as well. And so we're here to help make sure we have the right diagnosis and treatment, and that you're taken care of.
Okay. You mentioned imaging as kind of something that's used to help people with figure out what kind of arthritis they're dealing with. Can you tell me what imaging we're speaking about specifically?
So I think the most important thing is just simple x-rays, getting multiple views of the affected joints, like the hands, the knees, the feet, whatever's causing pain and inflamed on exam. That's the simplest way. However, some people, when their symptoms are starting early in the course of disease might not have the damage, because in order to see it on an X-ray, you have to have pretty significant damage. About 30% of the joint needs to be involved before we can see them on X-rays. So in that case, things like musculoskeletal ultrasound or MRI is very, very helpful to be able to detect those earlier changes that we see in some of our diseases.
Yeah, yeah. So, I think the next question that people are going to be thinking about then is, so you're saying that my joint will have to be damaged up to 30% um, before there's X-ray evidence. Can you make a diagnosis of rheumatoid arthritis even before any X-rays are showing any damage?
Absolutely. So early on in the disease, there's still the clinical signs and symptoms of rheumatoid arthritis. So, you have prolonged morning stiffness, the right joints are involved. And when I say that, usually the smaller joints, there's different scoring systems we can use to help us come to that diagnosis. And it has to be chronic. This can't be something that just started 3 days ago and now you're having joint pain. It needs to be ongoing for at least 6 weeks and generally longer than that before we have a diagnosis. And then the laboratory values as well. So it's not always the case, but most of the time, there's positive laboratory serologies that help point us in the right direction of rheumatoid arthritis.
Yeah. So it sounds like, it's a physical examination where your rheumatologist is examining your joints, kind of feeling if those small joints of the hands, like you said, and feet are affected. You want to know how long the patient has had it for. Sounds like some stiffness in the mornings, and some laboratory tests, maybe the rheumatoid factor or even the CCP antibody, CRP, are all things that we're going to take into consideration, even if the x-rays are normal, to really help to make that diagnosis. Does that sound about?
Exactly.
So then what's your approach? Because I know that when a patient goes, and sometimes they see different rheumatologists, and sometimes different rheumatologists have different approaches. What would say your approach is to treating a patient that kind of just comes in with rheumatoid arthritis?
I think the most important thing is education and understanding. So making sure that we're on the same page about what rheumatoid arthritis is and why it's important to treat. Because once that damage happens, you can't get it back. So if bone is lost, you can't get it back, but you can slow it down or stop it from getting worse, which is the goal. And so I think the focus of my approach is sort of early intervention and then tailoring whatever treatment we decide on to each patient's unique situation. So that may mean combining medications to control inflammation, as well as things like lifestyle adjustments, physical therapy, education, just in general on staying active and keeping the joints moving, because immobility is your biggest enemy. So making sure you're up walking around, moving, keeping those joints flexible is going to really benefit you in the long way. And so I think partnering closely with patients to adapt that treatment as the condition evolves, with a goal in mind of remission or at least low disease activity.
Yeah. One thing that you mentioned that people are very interested in would be lifestyle. I heard you say that. And so, I mean, but at the same time, you mentioned activity, you definitely, want to avoid immobility. Can you tell us a little bit more about what you meant by lifestyle?
Yeah, so lifestyle, things that help your joints in the long term. So staying active and exercise, flexibility, those things are all really important. Maintaining a healthy weight is helpful to take off some of the weight from the joints that are affected, as well as diet. So there's no specific diet that has been proven medically to say this is a anti-inflammatory diet or this is a RA diet. However, we do know that healthy, balanced diets are better for your overall health in general. And there's been a lot of research of avoiding things like really high processed foods and things that are high in sugars or added sugars and those kind of things. So just healthier, fresher is always better in not just your autoimmune disease, but in the rest of your health, your heart health, in general. It's going to be good for you.
Yeah, yeah, totally. I think we both know that people that have a lot of inflammation in their system, and whether it's inflammation from rheumatoid arthritis, there's an increased cardiac risk. And so, really looking at diet even more preventatively, and I totally agree with what you said. You want to avoid the preservatives, and the fresher, the better. Right. So people are always kind of concerned, "Hey, what is it that I can do?" And totally makes sense, resonates, the body weight and trying to reduce that adiposity because that extra fat is pro-inflammatory. So my next question is more on when a patient comes in, and one of the reasons I think, well, I got into rheumatology when you were still very young. And that was the time that a lot of these biologic medications kind of came to became available for our patients. And one of the things that we come across in clinic, and I know you've come across that too, is despite the fact that it inspired somebody like me to want to be a rheumatologist because now we can treat patients, the word a biologic medication sounds very scary to patients. And so how do we help the patient to understand these medications and maybe the value? How do you talk to your patients about this word? You're trying to put me on a biologic. I've never had to be on any medicine all my life. And now here you are, yeah, it's one thing, yeah, I have this rheumatoid arthritis. And now I'm being told here there's this biologic medicine. And how do you start to explain to your patients to kind of overcome that initial fear basically is what it is about, this intervention.
Yeah, so I think we've come a long way in terms of treatment options for patients. And as more options have evolved, they come with just a different set of side effects and a different set of risks. And I think it's important to just know where we're coming from, to know where we are now. So in diseases like rheumatoid arthritis and autoimmune diseases, like I mentioned previously, it's your immune system that's out of whack, that's attacking itself. And so in order to stop that from happening or to reduce it, we have to target the immune system. The only way to do that is to suppress it or to prevent it from being so reactive. And so in the past, we had these medications, and we still use them, things like methotrexate, sulfasalazine, hydroxychloroquine, but they aren't specific. They target the whole immune system. They suppress everything. And while they work great, and like I said, we still use them very, very frequently, doing that causes a lot of other risks to your health. Whereas these newer agents, like the biologic therapies, they're able to specifically target the part of the immune system that is causing the problem rather than the whole immune system. And so by doing that, you reduce a lot of the side effects and the toxicities we had from the old medications. And conveniently, these medications are much less burdensome on patients. The frequency that you have to take them, the route of administration has become much simpler. And so previously you might have been taking, 30 or 40 pills a week with the combination to be if you were on triple therapy and other sort of medications for your RA. Whereas now it's sometimes an injection or an infusion every couple of weeks or months even in some cases. And so I think when you look at it from that perspective, it's much better now than it used to be. I think one of the things that happens is you go and you get a medication from the pharmacy or from whoever's dispensing it, and they give you a whole list of these are all the potential side effects, and there's 30 pages of things that are to flip through. And it's important to remember that these are all from clinical trials. And so every time a patient had any symptom during that trial, it has to go on that list. And so no patient is ever going to experience all of those. And I'll say the vast majority of patients tolerate our medications very, very well with minimal or no side effects at all.
Yeah.
And so I think it's important to have that context when we're talking about our medications and treatment options.
Yeah, thank you. It totally makes sense and resonates, the fact that, yeah, if you pick up Tylenol, and you read through the side effects, you would drop that thing so fast. You'd be like, what? Liver failure? I just wanted Tylenol for my headache. Because exactly what you said, those things have to come from clinical trials, and that data comes, and there's a little bit of, making sure that even whether or not they think they can really attach it to that medicine, they will list all those side effects. No matter how rare they are listed under the side effect profile, just because of, well, one, it makes sense to list everything, because if your patient has an unusual side effect, it will be nice to know, hey, this is a possible cause, but it doesn't mean that 100% of people that are going to get that medication will in fact develop that side effects. So thank you very much for really just kind of cutting through the weeds and getting to, what's important is just that this has really made a huge impact on our patients' lives. And one thing we do in rheumatology is that we don't just hand you the medicine and say, see you later, right? It's that constant, it's ongoing care. And like Dr. Putz says, it's an ongoing partnership, to see you through the process. We know what the side effects are more likely to happen, and can walk you through and prevent that, from happening as much as we can. So, Dr. Putz, can you give us 3 tips that you feel that would be beneficial for anyone who's listening who has rheumatoid arthritis, for instance?
I think that the number one tip is don't wait to get help. So if you're having symptoms, if you think something is going on, call, get scheduled, come in to see us. We'll help evaluate and come to a diagnosis and get you treated. And if it's not rheumatoid arthritis, we'll point you in the right direction so you can get care for whatever symptoms are going on. I think number two would be don't be scared. We're here to help you with anything along the way, whether it's testing for diagnoses or side effects or helping just understand what's going on. We're always available to help answer questions and guide you. And then number three is take care of yourself. Stay healthy, stay active, eat a good healthy diet, and don't smoke.
The smoke. Definitely don't smoke. Well, thank you so much, Dr. Putz. I'm gonna have to repeat that. Don't wait. If you have rheumatoid arthritis, don't wait. Usually people are waiting because they're scared, so don't be scared. And then the third thing Dr. Putz says is take care of yourself, right? Don't smoke, right? And stay healthy, stay active. And thank you so very much, Dr. Putz, for taking the time to really kind of talk to our audience about rheumatoid arthritis, understanding what it is, understanding what the treatment options are, understanding what people can do to help themselves, understanding don't wait, don't be scared, and take care of yourself. And yeah, so Dr. Putz is a rheumatologist in the greater Seattle area, accepting new patients as of the time of this video. And so feel free to call our office at 425-453-0766, or go to our website at overlakearthritis.com and send a message that you would like to be seen. Thank you so much, Dr. Putz, for taking this time. Really appreciate it.
Thank you.
Okay, don't forget to like the video, subscribe, and we'll see you next time. Take care, everybody.